Today is a really exciting time in the history of Arthritis Ireland, and we're sharing 7 fantastic years of excellent work in the area of self-management course that we've run over 7 years, and 3,500 people have benefited from this course with significant impacts.
If we think about people with chronic illness, then we need to consider that they live most of the time outside of the healthcare system. That is, they are living in the community, they're not seeing their doctor, they're not in hospital. In fact, they live 99% of the time outside of the healthcare system. And what self-management is teaching them the skills and giving them the confidence to live that time in the most healthful way, given that they have a chronic illness.
What I learned when I did that course was that there was, a secret that nobody had told me before this, was that, the arthritis pain and the disease can create a whole lot of other symptoms, that I've medication problems, that you can be sad, that you can have all these sort of difficult emotions. So for me, what I learned to do was to kind of befriend that pain and fatigue and to use it to help me to monitor my disease activity. So that helped me to report then to my healthcare team.
We know the importance of people being on the right drug at the right time, and we know the importance of people adhering to their drugs. But we actually have a very strong complementary solution that works in combination with the medications, and that's self-management course.
We've done now more than 50 studies over a number of years, and what we generally see is people have more healthful behaviors. That is, they're exercising more, they're adhering to their medications better, they're communicating with their healthcare providers better, and at the same time they're having less symptoms. So they have less pain, they have less disability, they have less depression, and they're also utilizing healthcare services less.
The evidence is quite clear on that where we do that, people's self-perceived health improves, their ability to manage medicines and other aspects of their illness improves, and all around we get better outcomes for the health services. So we are doing some pilots in the HSE on peer-led self-management programs.
There's also very, very strong evidence to show around the world that will save money on the health system. And if you look at the Irish example alone, I reckon we've saved the health service executive about €4 million over the course of 7 years.
80% of the total bill for GP costs arises from chronic conditions, and 60% of hospital bed days. So I think that just helps build up a picture of the big, I suppose, challenge that faces us in our health system.
I think ultimately this course is not just about arthritis, it's about chronic diseases, and we hope many of our colleagues in chronic disease organisations will adapt a self-management course. I think ultimately the health system has to recognise that this is part of the prescription and part of the solution for chronic disease management, and therefore the associated funding needs to go with that.
We think that we should try to disseminate this throughout the HSE. That's a big challenge, but I think it's something we can't afford not to do.
So we have a number of key recommendations. And the first one really is that self-management should be a core clinical priority, and at the moment we don't believe it is. And our second recommendation really is around education and training for clinicians and health professionals in the area of self-management. And then our last one, there's a really vital role here for the voluntary and community sector.
Ultimately, this will save the health service a lot of money, but it'll also keep people out of hospitals, and it'll make people enjoy a far better quality of life.